In our health alert tonight, new guidelines for autism. The American Academy of Pediatrics has updated its recommendations for the first time in 12 years.
They're now urging doctors to identify at-risk children as soon as possible instead of waiting for formal evaluations.
Our chief health editor, Dr. Nandi, joining us live now with why this is so important. Dr. Nandi?
And Brian, it's important that kids who are at risk get identified as soon as possible for two reasons. Number one, they can start getting the care that they need. And number two, the earlier they start the treatment, the better the outcome. And that's why the American Academy of Pediatrics would like doctors to start checking for any sign of autism at every well baby visit and not to wait for formal evaluations, which typically take place at 18 and 24 months of age.
So do we know why autism has been increasing?
So Heather, autism is now being diagnosed a lot more than it has in the past. Back in 2007, it affected about 1 in 155 kids. Now it affects roughly 1 in 59 children. Now it sounds like a drastic increase, but there could be many reasons for this spike. For instance, the diagnostic criteria has really broadened. The definition has become more inclusive. There's now more public awareness of autism than really ever before, and there's more universal screening. Plus, some kids who were once diagnosed with intellectual disability, quote unquote, or a co-occurring genetic syndrome are now being diagnosed with this disorder. But there could be other risk factors as well.
Well, doctor, what do parents need to know?
So one thing the Academy actually would like doctors to do is to talk to families about genetic testing. Scientists know a ton about the potential risk factors in genes as well. And since many parents will turn to the internet, right, to search for answers, they can get easily find incorrect information and false solutions. But with genetic testing, it may help when it comes to understanding the cause and which type of autism a child may have. And this can play a key role when it comes to treatment. The bottom line is if we can get these children treated earlier, their outcomes could be better and we can help these kids.
Great information. Thanks so much, Doc.
My pleasure.
And if you have a question or a health concern for the doctor, you can email him, Dr. Nandi, at askdrnandi.com or send it to us on Facebook or Twitter.